Hello, everyone, and welcome back to OB Clarity with Dr. Godfrey, the podcast for nursing students. I'm Dr. Godfrey, and today we're talking about something real: how to handle clinical before it handles you. That's right. If clinical days have ever left you feeling anxious, overwhelmed, or like you're questioning your every move, this one's for you. If this will be your very first clinical, I'm sure there's some level of uneasiness that you may be experiencing, but I'm going to tell you what we can do right now. Let's take a deep breath together. Inhale, exhale. There you go. See? You got this. So let's go ahead and get into the subject today. The first segment is anxiety is real. And you're not alone. So let's start with this truth. Anxiety in clinical is normal, but unmanaged anxiety can interfere with clarity, with confidence, even safety. So it's important. You might second guess yourself and freeze up when you're asked a question. That's normal too. But it's not because you don't care or you don't know. It's because anxiety clouds your clarity. Believe me, I've seen it displayed in students over the years, and I know how difficult this is for them and for you. But you want to know something? You can take your power back. That's right, take it back. How? Well, I'm so glad you asked. So, we're going to talk a little bit about grounding yourself before clinical. So, before you even walk into the hospital or clinical site or simulation, check in with yourself. Ask these questions. Number one, what's really making me anxious? Number two, what's within my control today? And number three, what do I already know and do well? You have to give yourself some credit sometimes and recognize there are things you can do very well, and that can boost your confidence. But sometimes your body is in clinical, but your mind is still racing, trying this and trying that, even before you enter the unit. So find you a quiet moment, even if it's in your car or the bathroom stall. Take those 3 slow breaths, remember. In 2, 3, out 2, 3. And then say to yourself, I know what I know. I'm here to learn the rest. You're not expected to be perfect. You're expected to be present. I've always shared with my students, I don't expect perfection, but just progress. I do want to emphasize this next point with clarity. If you are unable to calm yourself and your anxiety continues despite your effort, please reach out to your healthcare provider, a counselor, a retention coach, or other professional who can assist you. There's no shame in reaching out for help. You are not alone in this either. So here we go. Let's talk about something that I talked about in episode 2. It focused on clarity over chaos, if you remember. So you do realize that chaos can penetrate the clinical environment. Yes, it can. When anxiety builds, clarity shrinks. That's why grounding strategies matter, especially before doing assessments, administering medications, or giving report. So slow down and choose correctly. Rushing in clinical often leads to errors. Take 30 extra seconds to check that med label. Confirm the route. Verify the medication administration record. Trust me, those seconds matter more than trying to just look it up real fast, right? Think about this. The order was to administer the medication, hydralazine. However, hydroxyzine was pulled from the medication dispensing unit. Totally different medications, right? But they sound similar. That's why it's important to slow down and choose correctly. The next point is to use your resources. Ask questions. Double check with your nurse. Pull out your pocket guide. That's not a weakness, that's wisdom. And then I want you to speak kindly to yourself. Your inner dialogue sets the tone. Replace, I'm going to mess this up, with I'm learning and I can do hard things. You'd be surprised at what a little bit of self encouragement will do for your confidence. Okay? So, in closing, remember I like to keep it short and keep it sweet, but useful. Clinical doesn't define you. I'm going to say that again. Clinical doesn't define you. So, I want to share the bottom line. Clinical is where we grow. It's not where we prove we're perfect. It's where we learn to manage fear with facts, to take a breath before we act, and to build clarity, one experience at a time. You're in control. So the next time you feel that anxiety bubbling up, remember, you can handle clinical before it handles you. And if no one told you today, you're doing better than you think. Keep going, keep growing, and always assess. Don't guess.